Welcome, everyone, to the Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy counselor, and I am joined with the magnanimous Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
Good. So the question I have for you is, how many people spell your last name correctly?
0.
Right. So you have two double hockey stick. You have a double hockey stick instead of one hockey stick.
No, I have one.
I'm sorry. You have one hockey stick, not two double hockey sticks.
I have one oar in the water.
Right. When anyone spells your name correctly, you're always ecstatic.
I am.
And you love that person.
Forever. They're forever my friend.
So if you ever email Amy at JasonMartinMD, just make sure you put one L instead of two. So today we are talking about brow lift.
Oh, but wait.
Oh, yeah.
I have news.
Oh, what kind of news you got?
I have news. I was a podcast guest.
Tell us all about it, Amy.
Well, it was great. It was a good time being a guest. I was a guest on the Headache 360 podcast, which talks about migraines and headaches in general. It's Dr. Adam Lowenstein. He was a guest on our podcast about a year and a half ago, and he had me on as his nutritional therapy expert, which was really super fun. So you guys should definitely check that episode out. We talk about headaches, but we also talk about how health in general is going to be beneficial for helping with headaches, but also just kind of living a better life.
And you should check out our episode with Dr. Lowenstein if you have a friend or yourself you suffer from migraines. It's a really informative episode. The stuff we talked about there was truly, interesting and novel. He does migraine surgery, so check that out also.
Yeah, so Headache 360 podcast. You can listen to me.
Amy is podcast famous. Started with Beauty and the Surgeon. Before you know it, you're going to be on every podcast.
I'm just guesting like crazy.
You're guesting all over the place. So today we are doing an episode on brow lift, Amy. Brow lift, forehead rejuvenation. There's probably a lot of other words for it, but this is what we're doing today. This is the topic. It's really interesting. When I was thinking about this episode, we've done almost most major plastic surgery procedures, and brow lift was one of the last ones. And it's weird because we do brow lifts all the time in our office.
We do. Brow lifts are really common, and I think a lot of people don't realize that that is the solution to the problem that they are having. Statistically, they don't realize it because in 2018, according to the American Society of Plastic Surgeons data, there were only just shy of 40,000 of these done in 2017 and even a few less in 2018. Going back to the year 2000, though, and this is what I found so fascinating. Year 2000, over 120,000 brow lifts performed.
You know why?
Botox. Vitamin B.
Yeah. Botox has absolutely changed everything we do with the forehead and around the eye area. So, before 2000, Botox was around late 90s, but it was just getting popular. People would choose surgical changes or surgical interventions as opposed to going to the dermatologist or the plastic surgeon and getting the Botox, and that's what changed. It's really interesting. That's amazing.
Yeah, a 68% decrease from 2000 to 2018.
And it's so funny because Amy being the stat lady, you think about almost all the things we presented have increased in number over that 20-year period, and this is the one that's decreased. So that's so interesting.
By a lot, too. It's not like it's a subtle decrease. I mean, it's a subtle decrease between last year, the last several years, but going back, like you said, 20 years of the decrease is pretty remarkable.
Do you think there was some plastic surgeon, ENT surgeon, ophthalmologist out there who was known for brow lifts and it's just hates Botox, because that's all they did?
Right. Well, he probably not, because he probably stopped operating sometime around the early 2000s.
Listen.
She stopped operating around the early 2000s.
Right. He's like, Botox is going to kick my ass.
Right.
I'm out.
Yeah, I'm going to start doing something else instead. My endoscopic brow lift is over.
Yeah, I'm done. Well, it's so funny because people never think they need a brow lift, but when they come in and see us and they got heavy eyelids, the first thing they do is what? Lift their brows. They take if you're watching on our YouTube channel, Jason Martin MD, they lift their brow up, usually the outside, or we call it the lateral side. And that's what this is what I want. And I'm like, well, that's a brow lift. Oh, I don't need that. I just need my eyelids done. So it's interesting. I guess it's not as common. 40,000 is really not a lot. And again, these are only plastic surgeons numbers. A lot of other people do brow lifts, ENTs and ophthalmologists do too. Amy, who's a candidate for a brow lift? Don't say me because I know I need it.
Oh, I know. I am a candidate for a brow lift.
Nils is not. He's got that
No.
Nordic blood, so he doesn't
He's
need.
a strong brow.
Right. So just the brow needs to be almost right over his eyeball.
Shade. He's shade. He's building his own shade.
Yeah.
He's got a built-in visor.
It just looks good on him with his muscles and his Nordic stuff.
So, like you said, a lot of people are candidates for a brow lift who don't realize that they are because they think that it's their eyelids that need to be fixed or adjusted or have surgery. But most people who have some brow ptosis, meaning their brow is descending a little, or they're having some heaviness in their brows or heaviness around their eyes, are probably a candidate for a brow lift.
So people that have problems with their forehead, they usually get Botox and they get their injections. And what usually happens when they get the Botox injection in the forehead?
Was this a question? You were looking at Nils, so I was like, are you asking Nils?
No,
or are you
I'm
asking
asking
me? The wrinkles go away.
Right, but then what happens?
They need more.
Yeah, and their brows get heavier at the same time. So a brow lift is very it's commonly indicated. A lot of the patients that we do facial aesthetic surgery on, facelift and neck lifts, almost always need surgeries with their eyes, and I would say a big proportion of those actually do need a brow lift. Mm-hmm. Not everyone chooses to do a brow lift for personal reasons, or they just want to get the major things done. But I think resetting the brows is the best way to make all your eyes look better.
Yeah.
And maybe not the lower eyelids, but it definitely helps.
It does. And that's a really important point, is that a lot of people who are not candidates for an additional blepharoplasty, and we have a great episode on blepharoplasty, which is eyelid lift, maybe they've had 1 or 2 or maybe even 3, and they think that their eyes are still the problem, when in fact it's that their brow has descended, and that's what's giving them that tired appearance.
Yeah, so you're seeing people that have had surgery before, feel a heaviness on their eyelids. They, I need to take more skin. At some point, you can only take so much skin, and you can't close your eyes. They can already not
close their eyes. Yeah.
Exactly. So then you would do a brow lift in that situation. Really good point. So who is a candidate? Well, if you look at brow position, the brows for women should be just above your orbital rim, and the brows for men should be probably at the orbital rim. Sans, our producer Nils, where the brow is below the orbital rim on his eyeballs. So if you think about that, and you touch
so much shaded.
I know. Well, Nils is awesome, right? So if you actually touch your the bone above your eye, Amy, are you doing that?
Yes, I am.
Okay. And Nils, are you doing that too? Yes. Okay, good. So if you touch above your eye, if you're listening to this, you're touching above your eye, you feel the bone that's there. That's kind of where your eyebrow should be, and actually should follow the contour of that bone. Mm-hmm. Now, women, you want the outside of the eyelid, or I'm saying outside the eyebrow, or the what we call the lateral side, to be above the rim. Now, does that mean, Amy, that the eyebrow on the outside or the lateral side should be 2 inches above the rim?
Definitely not.
Okay.
That's going to make you look very startled.
So whoever decided to pluck their eyebrows and then what do you call it? The tattooing? What is the new
microblade?
Microblading, and then make the eyebrows look 5 inches above your orbital rim or the bone. I don't think that aesthetically looks good. Am I throwing shade also?
No, I don't think so at all. But I mean, that is personal choice. And some of those brow position from a surgical standpoint and brow position from a makeup standpoint are different.
Right. And everyone has their own aesthetic, and we all support that. So if you're someone who feels like you have heavy eyelids, specifically your upper eyelids, if those eyelids are so heavy that they obstruct your vision, specifically the vision to the sides or straight up, if your eyebrows are below the bony margin, which we call the superior orbital rim, or at that level, but you want them a little bit higher, I mean, you're a candidate for a brow lift. Mm-hmm. And to be honest with you, that's probably a lot of people.
It's a lot of people.
One other thing with the brow lifts, some people have asymmetric brows. So if you're a person that has one eyebrow that's higher and one that's lower, and that definitely happens naturally, not just from bad Botox, you may be a candidate for a brow lift too. Types of brow lifts.
There's a couple.
Okay.
And I think talking historically about how brow lifts have been done would be very interesting, because they definitely are not done the way they were prior to the year 2000, at least commonly.
So now you're throwing shade saying I'm old.
No, I'm saying you're not old. That's what I'm saying.
Because I was training around the year 2000.
You were, but that's what I'm saying, before the year 2000.
Yeah.
I think the types of brow lifts that were historically done, and we've got some pictures if anybody's interested in looking at them, you can check out our YouTube channel, Jason Martin MD. were pretty invasive, which, makes it even more surprising that so many people are having these done because they involved a large incision.
And that was really common. And you imagine, we've declared that by the year 2000, they were doing a lot more, and they were doing a lot of these more invasive types. And I'm sure in the 90s, it was even more than the 2000s.
Right, because it was before they had the endoscopic
brow lift too. So in the old days, and I did a couple of these when I was going through training with Dr. John Polly, my chairman, craniofacial surgeon. They would do a bicoronal incision. So an incision from ear to ear. You start from one ear and you go up over your head down to the other ear. So, which is great and all until like you go in the water and then all of a sudden your hair pleats out and you see this scar, like literally
like a headband
going across your head.
Did those patients have just extreme bruising and swelling because you have to dissect so far to get to where you need to be?
I remember doing the training and watching this and saying, this is borderline gruesome, Like, are you serious? Like, are we that concerned about our brow lift position that we're doing an incision this long? They swell really bad. Now, people do this type of incision all the time. So we do facial reconstruction for trauma, and we make these incisions to gain access to the forehead and to the top of the eye and the orbit. If you need that incision, it's a great incision. It's a great surgical approach to fix things, right? Mm-hmm. But for an elective procedure that is primarily just for brow position, if you could do a less invasive approach, that would be great, right?
Absolutely.
It's the same. It's similar fashion to a tummy tuck incision. You go from hip to hip. You're going from ear to ear across the top of your head. So, but the old dudes will tell you, and ladies will tell you, that this is one of the best ways to lift your brow. And the problem with this incision is not that it doesn't lift the brow and it doesn't hold, is that you can lift it too much because you can really pull that whole forehead and brow up. It's very powerful, but most people don't need this very extensive surgery. So that bicoronal incision, if you look on our YouTube channel, Jason Martin MD, you'll see the incision. This is kind of a terrible picture, but you see the incision that's denoted by the yellow B. So in the late 90s, and I forget the guy's name, Vasquez, it was a guy in Birmingham, came up with an endoscopic brow lift. You make small incisions in the hair, not on the hairline, and you elevate the forehead underneath the skin using a TV camera or an endoscope, hence the name endoscopic brow lift. And then they would make small incisions, and they would elevate the forehead skin and then secure the deep layer of that to the cranium, to the bone on your skull. And I remember doing that surgery in training and boring little holes to put the permanent suture through. And I even remember saying to Matt, like, this is kind of nuts, So we would suture that up to the skull, basically.
What kind of suture would you use for that?
Like a proline suture. So for everyone out there who's going to do that on their neighbors, the next
but you think you'd
barbecue.
Be able to palpate that through the skin?
No, so it's up in the hair. It's up here. It's up into the hairline. So you imagine your forehead and you go higher up on your skull. It's back into the hair.
So they just pulled from here to here,
kind of. Yeah, exactly.
Okay.
But they would elevate the whole forehead down to the eyebrows.
Right, and then just put that anchoring suture up high.
Right. And then after that, they came out with something called endotines. So instead of using a suture to secure that soft tissue up and lift your eyebrow, they created these absorbable,
it sounds like a claw.
A claw, thank you.
Endotine sounds like a claw.
You would literally burr a hole in your skull and then set this thing in there and then take the skin and bring it up over the claw.
Oh.
And it would go click like that.
Lock it into place.
But here's the problem. So we did those surgeries. And people still do it now, and they act like it's a brand new surgery. This has been around for like 20 years, but that's, welcome to plastic surgery. Everyone claims that they're doing some new surgery that was done 20 years ago. These endotines, when you put them into the skull, you feel it. Mm-hmm. So it's like it's like one of those dermal,
like a dermal
piercing where you can feel the bump. Mm-hmm. And so we did this, and I'll never forget rounding on this patient afterwards. We did a facelift and we did an endoscopic brow lift with an endotine, and the attending wasn't there because in the universities you do all the care, they do the surgeries. And the lady was like, "Why do I have horns? Like I feel these bumps." And I was like, "Oh, those will go away." She goes, "How long?" I go, "About a year." She was pretty devastated, just so you know. So that's an endoscopic brow lift. That's an approach. It's commonly used to this day. The benefit of the endoscopic brow lift is that not only can you lift the brows, but you can remove the muscles between the eyebrows. So, Amy, do you remember those names?
Of the glabella?
Yeah.
What those muscles are called?
Yeah, there you go. Come on, you got it. Procerus.
Yeah.
Corrugator?
Corrugators.
Yeah.
Yes.
So the corrugators are the ones that make the vertical lines, and the procerus is the ones that makes the horizontal lines. So what do we call them? Like the 11s? Yeah, the ones. And you can actually remove those muscles with an endoscopic brow lift, which is awesome, right? So this was pre-Botox. People are like, oh, this is great. You can lift my brows, and I don't have any wrinkles between my eyebrows.
I'll never have emotions again.
I know. I'll never make a face again. No one will ever know when I'm mad. I'll just always look surprised.
Right? And I will never be perplexed. I am forever startled.
Welcome to the vortex of cosmetic surgery. So anyways, that was in vogue, and that was big. When I came out in practice in 2007, I mean, everyone was doing endoscopic brow lifts. I think I did a few also. And that's, I think, what's kind of utilized now. I think what's more in vogue now and what we do mostly is these hairline incisions, these less invasive procedures, which people with hairline incisions, where you place these, and it's more on the outside hairline on the forehead, they tend to heal really well and you just don't see them. Also, it only lifts the skin. On all these other types of brow lifts, it lifts the different layers, the fat, the muscle, into the layer of the subgaleal layer, which is an loose alveolar plane, whatever. But that it only lifts the skin, and those are long lasting. They don't tend to fall. One of the problems with the endoscopic brow lift is they don't tend to last forever, and we've seen patients like that. Yeah. So we've kind of moved to the hairline incision. Where would you describe the location of that incision?
I would say it's above and to the outside edge of your eyebrow. Like if you go straight up into your hairline from your eyebrow and then slightly to the side.
Yeah.
It's kind of there.
Yeah, exactly where you want to lift your eyebrow. Because you don't really want to lift the eyebrow on the inside near your nose, because that looks odd unless you really have, notable depression there or falling of the brow. And then it's more the outside of the eyebrow, and that's where you would put the incision.
We kind of have a picture of that, sort of, not really.
Yeah,
but
we have a couple pictures on our YouTube channel. You can see the bicoronal or the coronal brow lift, and then another one we do a temporal brow lift, and that just puts that in the hairline. Mm-hmm. So that's where we are. So you started with this incision from ear to ear, and then we moved to endoscopic and using TV cameras, and just like everything else, we try to make it simpler and less invasive now. Most people are using hairline incisions, but I think people are still using endoscopic. Mm-hmm. It's great alternative. It works well. Those are the types of approaches.
Yeah, no, they absolutely are. Anytime we start operating a new facility and we do a brow lift for the first time, I'm always asked if you're going to want the scope, and I always say no.
Right.
Like we don't do that type of brow lift.
So the endoscopic
still exists.
Endoscopic brow lifts, the problems I have with those, and this is my personal opinion, so please don't listen to this or watch this video and send it to your cosmetic surgeon, right? Because I'm sure they're great. Is that the endoscopic brow lift doesn't tend to last.
Yeah.
And I've noticed that, and there's data on that too. The second thing is you're putting incisions in the hair. So when you put an incision on the hairline, you don't have a risk of losing hair. When you put incisions in hair, you have a risk of alopecia or losing hair. So what's worse, having an incision, a very fine scar in your hairline, or having a bald spot in your hair? And that's the problem I have, and I've seen it. So for me personally, I think the hairline incision, a less invasive approach, is good. Just so you know, with any other types of surgical approaches, you can actually do a brow lift through a blepharoplasty or upper eyelid incision. That's called a transpalpebral blepharoplasty, and those can lift it a couple millimeters. That's an option. Lately, which we don't really know the true results yet because it just came out, we're doing AccuTite, which is these skin tightening things to lift the eyebrow underneath the skin. And Botox, done correctly on the outside of the eye, can actually do that too, can actually make a difference on that. So those are the approaches. Amy, why don't we go through, this is the way we do it, what it's, talking to the patient, what they have to do preoperatively, what the surgery is like, and the recovery.
Yeah, so I think the great thing about the way we do a brow lift is it is something that can be done in the office very comfortably. I think the biggest concern with doing it awake, So for anybody who's squeamish, not a good candidate for it because while you don't feel it, you do hear it. So that can be unsettling for some people. So if
but if you hear weird things and you know your brow's lifting, doesn't that just make you happy?
Well, no, I mean, maybe. But
you hear some crunchy stuff.
You hear some really crunchy things happen. And I think
it's a little disconcerting.
It is. It's a little disconcerting. But if that doesn't bother you, then it's absolutely a great surgery to do awake. It takes us about 45 minutes. It doesn't take long. It's not involved. We actually numb you up before anything even happens at all. So it's kind of like, Dr. Martin will inject all the local anesthesia in there before we even take you into the operating area. So it's pretty easy from that standpoint.
Sure. It's awake surgery. You're awake the whole time. You walk in, I inject some local. Then we take you in our procedure room. We put the sterilizing solution on you. I make an incision. I elevate the skin flap, nothing else. I don't touch the muscle or anything else. Elevate everything up to the place I want it. Remove the skin, do some suturing, and you're done. And then do the same thing on both sides. And again, they're totally awake, which is perfect.
Yeah, we wrap it up, kind of leave here with a big gauze turban that you need to keep in place for a day. Because there is, obviously it's a surgery.
You just tell everyone you had brain surgery.
Right, you get sympathy. You have bad concussion.
Why do you have bruising on your eyebrows? It was terrible brain surgery.
Yeah.
And then what's a recovery like? The recovery is something to consider in this, and that's true with an endoscopic brow lift or bicoronal or coronal incision or definitely the hairline incision. So let's talk about that a little bit.
Yeah, so the biggest thing that you're going to notice with recovery from any surgery that's up and around your eyes, forehead, face is the risk of bruising. And in a surgery like this, everything kind of comes down. You're doing a surgery on the top of the head. It's got nowhere to go but down.
It's like the most common question. Why do I have bruising on my lower eyelids? I thought you worked on my eyebrows. And you have to tell them that bruising goes down with gravity.
Settles. And it likes to settle around bone. So if we're doing surgery up above, it's going to want to settle right around the bottom of the eyelid, right where that bone is, where your cheekbone is. So that is very common. And we tell patients to expect bruising. Now, if you follow all our post-op instructions, you do all the right things, your bruising will be minimized. Will that mean you don't have any bruising? It's highly unlikely that you will have no bruising from your brow lift. If your doctor tells you won't, it's possible, but it's not likely.
The guy's a magician.
Yeah, because it bleeds. It's our head, it's our face. Like there is a lot of blood flow to these areas, and
then obviously the skin around the eyelids are thin, and so like the bruising is more visible.
Mm-hmm. Yeah. So I think that is really the biggest thing from recovery. Is it painful recovery? No. I mean, we don't even generally prescribe prescription narcotics or pain medication for this procedure. When it's done awake in office, most patients do Tylenol and are just fine. You need to sleep a little bit of an incline for a good week, and we may have you wrap, longer than one day, but typically we allow you to unwrap the next day. You can take a shower, you can wash your hair, wash all the blood out. And that's really it. You're back to most everyday activities. Now, there are some limitations on your activity for a few weeks. You kind of think about it. You don't want to do anything that's going to make blood start pounding around your body. You want to keep that blood going to the areas that are healing. Obviously, we don't want you leading your head below your heart, so not a lot of times, but any inverted positions.
No downward dog.
No down dog. Those are the big things without, walking around.
I was trying to think of the things that put your head below your heart. So downward dog.
Down dog.
Stuff that we're not going to talk about in the bedroom. Unloading the dishwasher.
Laundry.
Laundry, yeah.
Is another big one where people are up and down a lot and they start feeling really lightheaded.
Yeah.
They get that head rush.
Shower, shaving your legs, right?
You could sit and shave your legs.
Okay, well, sorry.
Bring
not
your
everyone
leg
has a
up.
shower you can sit in, Amy.
Sit on the floor of your shower.
That's disgusting.
It should be clean.
Yeah.
Cleaning the floor of your shower. Another story. Do that before your brow lift.
Gotcha.
That's too much bending over.
Yeah.
Cleaning in general is something after surgery that a lot of people, they're home, they want to, and it's not only is it physically active, but it also does usually involve a lot of bending, crouching, picking things up. So that I would discourage.
Yeah,
someone
most
from
things
doing.
you can do by just squatting down. You don't have to bend your head. But bending your head, getting in that dependent position is not good.
You'll feel that head rush right away.
Yeah, you get swelling and they feel uncomfortable.
Even just bending over to tie your shoes, your slip-ons.
Brow lifts are great. The way we do it, I'm not tooting our own horn, but the way we do it, they tend to recover well, but they definitely feel swollen and uncomfortable. So you want to just ice your eyes. You want to keep your head elevated. Don't argue with your significant other the day after surgery.
Keep your blood pressure low.
Keep your blood pressure low. Listen to some nice relaxing tapes. And I think you're good to go. It's a fairly simple surgery. It has a long-term outcome, especially with the hairline incisions. Some may argue with endoscopic brow lifts too, and that's their argument. Just overall, I think it's a win-win for everybody. The cost is less because you do it in the office, and it really solves the problems around the eyes. Now, Amy, what if we do the brow lift and they still have excess skin on their upper eyelids?
Well, that's a blepharoplasty. That's an eyelid surgery. If someone truly has excess skin on their eyelids, that needs to be addressed either at the same time or in a separate procedure.
Can we do that in the office with them awake?
You can. You do that at the same time.
Yep. What will we do, the blepharoplasty first or the brow lift first?
See, we actually have done this, and that was always the conversation. We do the bleph first, and then we do the brows.
Right.
Because a person needs to be able to close their eyes.
Well, you could do it the reverse and then change your markings for the bleph, but you inject the local so it gets all
So
messed
it's
up.
hard to tell. And that's the conversation. When we've done this, that's what we've been like, what do we do first? And we always do the eyes first.
Yep.
Because we have to trust our markings. Once everything's injected, it's all blown up and weird. But the nice part is we do the eyes first. By that point, the local's been absorbed in the eyelids. We've taken off the excess skin so we can really see how aggressive we can be with the brow. Whereas if you went the other way around, you never want to change eye shape. So if somebody goes super aggressive on your brows and then does your eyes, like, I think if it was me as the patient, I'd want my eyes done first to make sure that they look great, the shape was good, and then make sure that my brows weren't pulled over aggressively.
Sure. And right, that would be terrible to do too aggressive a brow lift combined with a blepharoplasty. It would just look terrible.
It would. And while
We've not had that problem, but you could see how potentially that could happen.
Mm-hmm. And that can happen just with too many eyelid surgery. I think that's a lot of people, especially men, that's their big concern, like that their eyes are going to look funny, because we've all seen those horrible pictures of plastic surgery on men specifically who get really odd shaped eyes, or women.
Who do we talk about? Kenny Rogers?
Kenny Rogers, yes.
I think he's like sick now, so we can't talk about him
No,
anymore.
but his bleph was odd, or maybe his bleph and his brow lift combination was odd. So if that is a concern of yours, if you're concerned about the shape of your eyes or the way your eyes look, but you do need some brightening of the eye overall, a brow lift may be a great option for you, to kind of help lift that brow position, which is going to brighten up your eyes without, making it look like you have changed your eyes. Your eyes are still going to look like your eyes.
Now, we kind of skipped over this, but I think it's important to note that the reason that brow lifts are beneficial from a beauty standpoint is why, Amy, because they kind of open up your eyes and they make you look more alert and rested. And there's some physiologic appearances. When you look at someone that has a more open eye, they look more healthy and they don't look menacing, right? Someone with a squinted, like, heavy eye, they kind of look angry. There's components of this that definitely improve your appearance, and these things are a lot more common as you age because the skin and soft tissue relaxes. You get something called dermatochalasis, which is a medical term just to make us feel important. So we have a
CPT code is
secret language.
347.28.
No one else knows what we're talking about. Did you see that lady's dermatochalasis?
Terrible.
Oh my God.
Oh, she does it.
That's like the conversation at a plastic surgery dinner.
Yeah. Like, oh my God, look
Did you
at
see
that
the waiter's
ptosis.
dermatochalasis? Oh my God. Anyways, the it does really help with that, and it really helps open your eyes. The eyes are a big part of beauty, especially the face, and opening the eyes and making it look more youthful. And honestly, if you look at children, FYI, they don't have eyebrows that are way up their forehead like people want to do, but they definitely have more of an openness to their eyes, not a heaviness. They have a defined crease of the upper eyelids. Their lower eyelids don't look have herniated fat and crepey skin, and they just have this overall appearance of youth. And so ultimately, putting that brow position back in a good position really just does improve the way you look.
It does, and it also will save you money on Botox if you've been getting a lot of Botox. People like start compensating by trying to raise their eyebrows, and eventually, like we talked about in the beginning, that stops working as well. Like your brows are continuing to descend, gravity's still pulling down on them, and what can happen if anybody's ever had too much Botox in their brows and it's dropped it?
I remember early in our practice, we had our marketing person. I did that, and I didn't give her that much. She just was compensating so much. Her brows were so heavy at a young age. She had really aggressive wrinkling on her forehead. I was like, I can take care of that because I'm an amazing plastic surgeon, Mr. Smart Guy. So I go in and Botox all this stuff, and all that kind of compensation that she was doing just to keep her eyes open, the brows kind of came down hard. And once you see over-injected foreheads with Botox and what their brows look like. It's just, it's terrible.
Well, and how that feels to the person as well. Like that, again, like that kind of limits your functionality.
It wasn't even just the way she looked. It was the way she felt. She's like, my
Yeah.
eyebrows feel so heavy. Now, fortunately, if this ever happens to you, just FYI, you just wait a week or two and it tends to wear
Botox
off.
wears off.
Yeah. And there is some things you can inject or that will help that, but something you can inject. The injection's actually more for the upper eyelids if those tend to be droopy, but there are some things you can do to make it better. Overall, though, that's the problem with Botox. Botox treats wrinkles. Some of the wrinkles are caused by the fact that your body's sensing that your eyebrows are heavy or eyelids are heavy and it's trying to lift them. If you inject the Botox, you can make your brow ptosis or droopiness worse.
Mm-hmm. Yeah. The good thing, I always say the good thing and the bad thing about Botox is it wears off. So good, but it's great, but it wears off. It's horrible. Well, it's going to wear off.
Yeah, that's why every dermatologist loves it.
Exactly.
So you come back every 3 months.
Every 3 months, it's going to wear off.
So our patients, when they come back, we're like, "Do you sure you want to keep doing Botox? Why don't we just do the
do a brow
surgery?
lift, yeah.
Let's get this over with."
Save you some money.
45 minutes.
Yes.
Well, I mean, I don't want to minimize the talk, but I feel like we hit it out of the park with the brow lift.
Yeah. I mean, that's what I say every time.
I don't want to brag, but
Well done, brow lift.
now that we know that you're a famous guest podcaster, yeah, I think that brow lifts, if anyone listening to this or watching this, just understand that brow lifts are a great option. They're a low risk procedure. If they do the scar on the hairline, at least in our hands, don't worry. That scar is going to not be visible. You can lift the brows as much as you need and no more, and it'll last a long time. So that's worthwhile. In our hands, you do it in the office under local anesthesia, which is a real benefit. And about 2-week recovery of swelling and bruising. You definitely don't want to do a brow lift before you have some big event. If you're going to your daughter's wedding, I would not do the brow lift 2 weeks beforehand.
Yeah, and also if you were planning a big swimming vacation or somewhere where you could not be out of the sun, this is a scar on the top of your head. It's very close to this, closest to the sun as you're going to get. So hats and sunscreen are going to be things we're really going to enforce for that first even year. So we don't do a brow lift if you can't be out of the sun for at least a little bit of time.
So let me ask you, because we always ask our guests questions. Let me ask you a
Oh,
question.
I'm the guest.
Yeah.
Yeah.
Would you do a brow lift?
Oh my gosh, I need a brow lift. Like, you know how much time I spend in the mirror doing this?
Just a little bit.
Just a little bit,
I would too.
right? It's just that little bit.
I'm not like I wouldn't do like tons of cosmetic surgeries, the ones that are indicated for me, but I would definitely do a brow lift.
Yeah. Because like you said, one of the things that we do look at on people is their eyes. So much of the things that we perseverate about on our own bodies, no one's looking at.
Well, okay, depending on the situation.
Right.
There's a lot of women that come in and say that this guy was looking at me, but like in most cases, in normal human polite contact, they're looking at your eyes or your mouth. Mm-hmm. That's
Yeah.
it.
So fixing those little changes to those areas can make a great improvement. So yeah, I'd
Right, and
absolutely
you
do
can
it.
feel more confident. You can
Yes.
you look better in pictures and all that kind of stuff.
Yeah, feel
It's a
better.
small thing with I think a large outcome. So something to consider.
Brow lifts are good.
Let's go brow lifts.
Thank you so much for listening. If you enjoyed this podcast, be sure to leave us a comment, like us, rate us, review us, share us with your friends. We really appreciate it. On Instagram, we can be found at Beauty and the Surgeon Podcast. And we are everywhere you listen to podcasts. We're on Spotify. Check us out.
Which is awesome. I just got Spotify. I know I'm like 12 years late, and I love it.
It's awesome.
Yeah. And you can follow. Did you say follow us on Instagram too?
Yes, I did.
Okay, good. All right.
Instagram us up. Hit us up on IG.
Hit us up in the IG scenario. Okay. Brow lifts are good. We love it. We're for it. Come on in. We'd love to see you.
Thanks, everyone.